Good afternoon, and thank you for joining me today. Today we're going to be talking about pregnancy genomics. We're going to be talking about some genes that specifically are extremely important to know about while somebody is preparing for pregnancy, during pregnancy, and even after pregnancy. So this is a really exciting time in healthcare and nutrition and genetics. Things are starting to really come together in a very synergistic and collaborative way. And systemic formulas is definitely at the forefront of creating a very understandable and powerful tool set for practitioners to use. And this, I hope, will be a piece of that. There's going to be information here that is going to help multiple different people, that it's going to be good for people that are at the very beginning of learning about genetics and people that have studied this for a long time. And this is, an old hat for them. So I promise you'll learn something if you just listen and stick around for the duration of this webinar. So here's the disclaimer, and then we got the disclosure, and then we're going to jump right into the pregnancy genomic SNPs. And first of all, we're going to talk for just a second about what is a SNP. I know a lot of you guys probably already know this, but for those of you that do not know this yet, the genomics, a SNP stands for single nucleotide polymorphism, and that's where, as you can see on this slide, the genotype might be exactly the same for a gene, except for there's one single nucleotide, that, like an A or a G or a T or a C, that changed from one person to another. And a lot of people have different single nucleotide polymorphisms. They have little changes here and there. That's kind of what makes us unique. Some of these are benign. Other can be more of a problem as far as our health goes, because they might change an enzyme's function or the ability of an enzyme to operate underneath a certain pH or temperature, or change the shape, and that can really alter the metabolism of one's body, which can create ultimately health problems down the road. So this is what we're going to be talking about: SNPs, single nucleotide polymorphisms, specifically as how they relate to pregnancy. So if we go to the next slide, I'm going to start out with a little bit of a non-traditional start to a pregnancy seminar, but bear with me here. This is important simply because when we're listening to this seminar, I want you to also be thinking about not just singularly on the mom and the child, but also don't forget about the father. The father, they do more than just sperm donors. What we found, especially from this study, which was a landmark study, they found that basically they fed these male rats a really high-fat diet, and they found that the female offspring of the rats that were ultimately the female offspring of the rats that were males that were fed a really high diet, they developed insulin sensitivity and early beta cell destruction. So beta cell destruction is, these are the cells of your pancreas that are insulin producing. And if you have early beta cell destruction, that means you're going to have a lot of blood sugar problems, which is a bad thing. So this wasn't a change in the genes necessarily. This isn't an alter in there. We didn't change a nucleotide, but they changed the environment, and that really did ultimately change the long-term health of the offspring. So when you are looking at getting somebody ready for pregnancy, then don't just think about the mom. Bring the father in and look at their SNPs too. Look at their health. What are they eating like? What are their genes like? Half of the genes that a child inherits is from their father. So if we're going to be talking about genes, we've got to also include the father in the conversation. And when you're talking to a family about genes, ultimately it brings in, they're going to want to start talking about their grandparents or their children or aunt or uncle, because one thing that these people share is genes. So you might be sitting there talking to them about getting ready for pregnancy, and they might say, oh my gosh, my uncle has that problem and I want to avoid that. So this can really be a family affair. So don't forget to look at the father. at the point of conception, he's got to be eating healthy. He needs lots of antioxidants. If the father's low in antioxidants, they're going to have more basically DNA damage in the sperm, which you do not want. And don't forget to look at his SNPs, because even if you look at the mother's genes and they look really good, don't forget that that baby is going to be inheriting some of the genes from the father, and you need to address that as well. So if we go to the next slide, we're just going to talk briefly about the Pottenger's cat study, which I'm sure a lot of you have heard of, but I just want to review it. So this was an epigenetic study that was over 10 years and 900 cats. And they basically, Pottenger, he was a scientist, and he divided the cats up into two different groups. The first group of cats, they were fed just raw milk, raw meat, and he watched them for 4 generations. They were healthy for all 4 generations. Group 2, those cats were fed cooked meat and milk. And what they found was that with each generation, they got a little bit less healthy. So that by the 4th generation, there were no surviving offspring at all. With the first generation, they found that degenerative diseases started, and the cats became quite lazy, they said. Well, the cats weren't lazy, they were tired because there was something wrong. There was something wrong in their metabolism. So then the second generation, by the end of the second generation, the cats had developed degenerative diseases by midlife, and they started to lose their coordination, so starting to get neurological problems. By the third generation, they had developed degenerative diseases earlier in their life, and some of them were born blind and weak, and then others had a shorter lifespan, and many of the third generation cats couldn't even produce offspring. So they also had an abundance of parasites, so their immune systems were not healthy. They had a lot of skin diseases and allergies. Actually, over 90% of them had that problem, whereas healthy cats, only 5% had that problem. The behavior changed. Bones became soft and pliable, and ultimately, by the 4th generation, there were no cats. Ultimately, they attributed this, they later found out, it was because there wasn't enough of the amino acid taurine in the diet due to cooking the food. So it was an amino acid deficiency that was over time and over generations was compounded over time. And so it's just, we know that genes can be passed down get passed down from generation to generation. And we know that issues related to genes can create mineral and vitamin imbalances that, if they get compounded over time, can truly create such circumstances as what one might see in Pottenger's cats. So we know that we live in a time where there's a increase in degenerative diseases, chronic diseases, allergies, neurological problems, and perhaps some of it is just, generation after generation of maybe not getting exactly what they need. And wouldn't it be wonderful if we could create a personalized health plan for somebody that really looks at their genetic SNPs that maybe decrease their ability to have the healthiest possible offspring? Because there's really no time in one's life where they are more vulnerable than when they're in utero. And there's perhaps no time in one's life where you can really make a more powerful impact in one's health. And that's why we have to look at pregnancy. And this is really the tip of the iceberg as far as pregnancy is concerned. So we're going to start talking about the SNP. So if you go to the next slide, the first SNP we're going to talk about is the FADS2, which stands for fatty acid desaturase 2 gene. And so this is a SNP that if you have the G allele, then you are less likely to create the fatty acids like arachidonic acid or DHA. And if you're not creating enough of these, then it can create ultimately problems with decreased healthy brain development. So arachidonic acid is largely found in chicken, meat, eggs, those type of things. DHA largely found in fish. And DHA is extremely important, not just for brain development, but also for retinal development. So this is one of the SNPs that you're going to be seeing on Systemics and Dr. Shane's genetic test that is available. So if we go to the next slide, then if you look at the picture on the left, there's this 35-week, this is in utero, the 35-week, this is a, in utero, the 35-week brain, and then the 39-week brain. And so basically, the brain is growing exponentially, not just in utero, but even postpartum. And it's extremely important that the baby has what it needs to have a healthy brain. And what it needs to have a healthy brain is vitamins, minerals, but also healthy fats. And so they found that for this specific genetic type, the FADS2 gene, that children that had two risk alleles, so the GG genotype, they had inherited the bad allele, the G allele from both of their parents, they were going to be more likely to have a higher, so they were going to have a higher IQ if they were breastfed than if they were formula fed. So if they were breastfed, then they would ultimately probably be getting more DHA in their milk and more of those unsaturated fatty acids, the long chain unfatty acids. So we know that people who have this genetic type are at a higher risk for not having enough DHA, not having enough of those good fats to have a healthy brain. And there's certain people that are at a higher risk simply because maybe they're a vegan or a vegetarian, and they're simply at a higher risk for having this decreased ability to make DHA. So the people that have the FADS2 risk allele, one or more, they're less likely to be able to make the DHA and the arachidonic acid, which means they're going to need to get those things from their diet more likely in higher quantities. So if you look at people like vegans and vegetarians, they're probably not getting quite as much of the DHA and arachidonic acid from their diet, and simply because they're not eating the meat and stuff. So these are going to be people at a higher risk for having problems. Now, if we go to the next slide, then this study, it looked at the long chain polyunsaturated fatty acids, like DHA, and saw that there is basically a direct correlation with cognitive development in a child and the amount of long chain polyunsaturated fatty acids that they were getting, and they were also measuring DHA. So on the right side, they were showing the breastfed versus the non-breastfed, and the breastfed children were getting a higher amount of the long chain polyunsaturated fatty acids such as DHA. So this really does support the idea that if you have this FADS2 gene and risk allele, and you are concerned about your child not having, having a health problem from it, like not having as high of an IQ, not as good of brain development, not as good of retinal development, then of course try to breastfeed. That's always the best thing possible. If you are breastfeeding, great. Make sure you're also getting plenty of DHA, because what you consume goes into your breast milk. But if you can't for whatever reason, then make sure that these children are getting supplemented with DHA, and that's what we'll talk about in just a minute. So if we go to the next slide, then we're going to briefly talk about the DHA from food. So pregnant women are supposed to get at least 300 milligrams of DHA daily. And ideally, pregnant women eat about 2 to 3 servings of low mercury fish per week. If that's not happening, or if that can't happen, then you need to get your DHA from supplemental sources. I would say you probably need to get your DHA from supplemental sources even if you are eating fish, because one, you really do have to be careful about mercury in fish. And so low mercury fish being the smaller fish like salmon, cod, tilapia, herring, anchovies, perch, and flounder. And then the high mercury fish being like tuna and the larger fish, orange, rough orange roughy, mackerel, marlin, tilefish, sea bass. But if we go to the next slide, then you see that, a lot of the fish are either you can't eat them because they have too much mercury in them, or things like tilapia that you can eat. They really don't have that much good fats in them as far as DHA goes. So you're really kind of left with salmon. And so basically, you got to be careful. Salmon or herring. And if you can't get enough from your diet, then you need to look at supplementing. So if we go to the next slide, we'll look at the ALG, and ALG, it basically is liquid DHA, and it has 550 milligrams of DHA per serving, and that's more than enough for a pregnant woman to get on a daily basis, as far as making sure that not only she has a healthy brain, but also her developing fetus. So it's important to remember that, if somebody is passing on this gene to their child, then they probably, either they have it themselves, and they're either getting it, a child's either getting it from the father or the mother. And if somebody's passing this gene onto their child, they may have a lot of the same problems. Like perhaps if their parents had plenty of DHA, then maybe they would have had a better developed brain or better eyes or something. So when you're thinking about keeping your child's brain healthy, also don't forget about yourself. And we hear a lot about things like postpartum depression. And in some cases, things like postpartum depression can be improved by lots of good fats like DHA. So ALG, it's a great resource to help boost DHA in a very safe, effective way. And if we go to the next slide, then we see the CVO oil, which stands for cardiovascular oil, and it is great for that, but don't think that it's only for your heart. It's great for lowering inflammation and having the good fats like EPA and DHA. Now, per 2 caps, it has 102 milligrams of DHA. So this by itself is probably not enough for a pregnant woman. I would say it's good in addition to the ALG, but by itself, which I think all pregnant women need to be on a good fish oil, but I think being pregnant, you deserve to have that extra DHA, especially if you have this FADS2 gene. So remember, FADS2, extra DHA, and fish oil. So if we go to the next gene, the factor V genetic variant, this is actually a clotting gene, but it has some real world important implications for pregnant women. And it's worth noting, and it's not something that a lot of people think about in terms of pregnancy, but if you have a patient that has this, or if you have this, or if you know somebody that has this, then it's important to know as much as possible about this gene. It can be very hazardous to one's health. It can increase one's risk for clotting, embolisms, deep vein thrombosis, things like that. And if you have this, you need to let all of your prescribing doctors know, all of your natural health care providers. You need to let anybody that's doing surgery on you know this, because you're more at a risk for a clot. So if we go to the next slide, then we get to see some of the important information about why is the factor V coagulation factor V genetic variant so bad. So yeah, it is an increased risk for clotting, and it does carry more risk for women than men, although there's plenty of men with factor V that have clots and health problems from factor V. However, women are at a slightly higher risk, and women are at an increased tendency to develop blood clots during pregnancy or when taking hormonal estrogen. So that could be on birth control, hormone replacement therapy, any of those times, but more likely during pregnancy, because during pregnancy, one's estrogen levels naturally increase. So you got to be careful about clotting during pregnancy for these women. Also, we know that women with the factor V genetic variant, they're at an increased risk for pregnancy loss, and they're 2 to 3 times more likely to have multiple miscarriages. or pregnancy loss during the second trimester. They're also at an increased risk for pregnancy-induced high blood pressure, preeclampsia. This is very serious. And also at an increased risk for slow fetal growth and early separation of the placenta, which is placenta abruption. So all of these health conditions are very serious, very traumatic, and possibly avoidable if one knows about this genetic variant ahead of time and takes actions to prevent it from being a problem through nutrition, lifestyle, dietary changes. The increased risk for clotting during pregnancy is 3 times as much as somebody without this genetic variant, which is pretty significant. And clotting anytime is very dangerous, but it's particularly dangerous around pregnancy. So please let people know that they have this and what it means and what they can do about it. This is not related to pregnancy, but it is worth knowing that people taking tamoxifen are also at an increased risk for clotting if they have factor V. So you might have a patient that comes in and you tell them, oh, you have factor V, and you increase risk if you ever take tamoxifen. And they might say, oh, my mom's on tamoxifen. So it's important to know as much as possible about these genes, because you never know when these little nuggets of information are just going to really help somebody, including you. So if we go to the next slide, then this is a research article where they looked at, they gave these women who were 45 or older 600 IUs of a natural source of vitamin E, natural being key here. You want to stay away from synthetic vitamin E. Any health problems you hear about from vitamin E, it was synthetic most likely. Natural forms of vitamin E in the complex are very healthy and can be very advantageous under the right circumstances. Synthetic, stay away from those. And systemic only uses natural, of course. So women with this factor V genetic variant or the prothrombin mutation, which we're not going to talk about right now because we'll talk about that in a cardiovascular and clotting seminar in the future, but that's not as important specifically for pregnancy as factor V. But women with this factor V genetic variant were 49% less likely to have a cardiovascular type clotting hazardous event from taking vitamin E, the 600 IUs of vitamin E, which is significant. So they were less likely to get things like a DVT and a clot, which is significant for something so simple as taking a vitamin E, which has a lot of other wonderful antioxidant activity and ability to really help people with preventing DNA damage. So if we go to the next slide, so just understanding a little bit more about the epigenetic support that you can have for anybody that has factor V, because we want to know as much about these genes so we can really have a holistic, all-encompassing approach to helping people. So fish oil is a great blood thinner. Anybody who is pregnant, like I said, needs to be on fish oil. This is even another reason to maybe give a higher dose of fish oil for somebody that has factor V. And vitamin E, as we mentioned before, has had great success with factor V. And then avoid clots by, don't be sedentary, which you don't want to be sedentary anytime, but especially during pregnancy. Maintain low inflammation, healthy weight and blood sugar and blood pressure. Maintain that. That'll decrease your risk of a clot. And then caution with any type of hormones in the future, and then abstain from smoking, of course. So those are some great ways to reduce clots. If you go to the next slide, then again, CVO oil. We talked about this before, but it's a great tool for anybody that has factor V. Not just the FADS2, where it's got the DHA, which is wonderful, but fish oil is a blood thinner, and so is vitamin E. So it would be helpful for anybody that has factor V. Of course, you want to talk to the patient about, if they're having a scheduled C-section, they need to decrease their fish oil and vitamin E to a certain extent going into that, because it is a blood thinner and they don't want to, bleed too much. But you also don't want them to have a clot post-surgery in the hospital. So, making sure that their doctor is aware of their genetic variant is very important. I've actually had a patient who I told her that she had this factor V problem, and she went and she told her prescribing doctor, and the prescribing doctor took her off of birth control. She had a family history of clotting, but once her prescribing doctor knew, oh my gosh, you have this genetic variant and a family history of clotting, and you're on birth control, this is a really dangerous circumstance, she took her off of it. So I thought that was kind of interesting. So if you go to the next slide, so natural sources of vitamin E. There are a lot of natural ways to get vitamin E. Please try to get as much through your diet. Diet's key. But in this study, for people with factor V, I don't think that natural sources of vitamin E is necessarily going to be enough. So if you can only get 20 milligrams of vitamin E from a tablespoon of wheat germ oil, that's a lot of wheat germ oil before you can get to that 200 or 600 IUs of vitamin E that people with factor V have really been shown to do well on. And that's where we look at supplementing. So that's where, if you go to the next slide, we can look at systemic formulas, EZV. And this is a natural form of vitamin E and the vitamin E complex. So we're getting multiple different types of vitamin E, not just one. And it's a great product. It's a great tool. Anybody that has factor V, you should consider this as a powerful tool for them in addition to the fish oil. So if we go to the next slide, then we get to start talking about methylation. And methylation is very important as far as pregnancy goes. People that have methylation issues are more likely to have pregnancy complications. It's been associated with more nausea, vomiting, stuff like that during pregnancy. And so this is an important study that is kind of going to be an introduction to some of the methylation genes. We're not going to talk about all the methylation genes today. A lot of the methylation genes are, if you're interested in that, are in the seminar that is on homocysteine, and that would be something to look at if you want to learn more about the methylation genes. We'll also have more about some of the methylation genes in upcoming seminars about the brain, and we had some of the methylation genes in the detox seminar on the phase 2 detox part. So it's a big topic, but we're going to try to zero in on some of the most important ones for pregnancy so that you can kind of have those tools in your tool bag. So in this study with these pregnant brown mice, they exposed all of these pregnant brown mice to BPA. BPA is an endocrine disruptor. It disrupts methyl detox pathways. And what they found was that the mice that were exposed to BPA they gave birth to unhealthy yellow mice. So the yellow mice it's associated with being an unhealthy type of a mouse, basically. The pregnant mice that were exposed to BPA and, in addition, given methylation support such as vitamin B9, B12, betaine, and choline, they did not have yellow offspring. They had healthy brown offspring. They at least appeared to be healthy. Maybe there was a problem there that we were not aware of, but the color at least was good. So the concluding thoughts here are that, one, BPA is a toxic chemical that can have a negative effect on an unborn child and or mouse. BPA is ubiquitous, so it's something that we're all exposed to and we all need to be mindful of, but especially pregnant women or women trying to be pregnant. We also know that any female of childbearing years should be supplementing with nutrients that will help them truly methylate and protect them from BPA. So because they're going to be exposed to BPA eventually, and that anyone that's exposed to BPA, which is everyone on the planet, they can be exposed to BPA from eating or drinking out of plastic containers, eating canned foods, handling receipts, or many other ways. Anyone exposed to it should protect themselves with nutrients that help them methylate so that they can detoxify BPA and ensure that they have healthy methylation pathways. So if we go to the next slide, then we're just going to kind of remind ourselves a little bit about the methylation cycle. And in the methylation cycle, we have vitamin B12 and we have vitamin B9, and we have a bunch of different enzymes. But we're going to really focus here on the MTHFR enzyme, because you can't talk about pregnancy and genetics without talking about MTHFR. Because it's important, it is. So what MTHFR does is it takes the inactive form of vitamin B9, which is folate. Folate is what is found in green leafy vegetables. And then folic acid is the synthetic form of vitamin B9 that it's the synthetic form that's like in fortified foods and stuff like that. Systemic formulas doesn't have any folic acid in any of their products, and they removed any folic acid a long time ago, I think years ago, from their products. But you might find online that it still says that. If somebody else is posting about a product, it might be an old photo or something. So just know that if you see folic acid in a systemic product, it's not correct. They don't have folic acid in any of their products. So they do have a lot, however, of the methyl activated form of vitamin B9, which is L5-MTHF. And so L5-MTHF is what the MTHFR enzyme creates. It takes that inactive form of vitamin B9, either folate or folic acid, and it converts it into the activated form, which is the L5-MTHF. And then from there, that's kind of helping to churn the wheels of the methylation cycle so that the body can be healthy and have all that it needs for methylation. So if we go to the next slide, then we're going to be looking at the two genetic variants, the two SNPs for MTHFR, and there's really two that are significant. Some people might think there's way more. There are really only two that have been proven to be significant. So we're talking about those two. There's the C677T and the A129AC. So the top one, the C677T, that is more strongly associated with neural tube defects. And the A129AC, there is some association with neural tube defects and neurological problems for sure, but more strongly the C677T. Both of them significant, both of them correctable. It's just a matter of supporting the body with that L5-MTHF. L5-MTHF, it's a naturally occurring form of that vitamin B9. It's truly a blessing that we live in a time where we can have that if necessary. And it is necessary for a lot of us, myself included, that have a MTHFR type genetic variant. And so it might seem kind of like a nonchalant thing, but giving somebody something, a nutrient that they cannot metabolize or create properly, it can have profound and life-changing effects. So if we go to the next slide, then we get to see some of those problems that MTHFR is associated with, and some of the problems that simply supplementing with the L5-MTHF can help to decrease the risk of. So there's a lot of issues here. I underlined the ones that are definitely associated with pregnancy, such as pregnancy complications, neural tube defects, miscarriages, reproductive problems, preeclampsia. And so these are issues that are direct, obvious pregnancy issues. What's a little bit more gray here is that many of the issues that are attributed to MTHFR in adults, such as maybe bipolar, schizophrenia, autism, autoimmune diseases, they may have been a result of problems that kind of started in utero, maybe of neurological pathways that were laid down in utero. And perhaps had one's mother had adequate levels of vitamin B9, particularly if they had MTHFR, hopefully in the methylated form, perhaps if their mother had had adequate levels of vitamin B9 in the methylated form, hopefully, then maybe these adults would be less likely to have some of these neurological issues. So it's just, something to think about. Are we kind of like the Pottenger's cats that are kind of, our health problems are compounding with time? And, my Great-grandparents, very healthy. Grandparents, very healthy. Mom, not quite as good. And, I've dealt with a lot of health problems myself that have been helped tremendously through, environmental changes. But I feel like with my daughter, things are moving in the right direction, but it's definitely a forceful act of nature to make sure that she stays as healthy as possible. And when I was pregnant with her, I was very concerned about making sure I had plenty of nutrients. Interestingly enough, when I went to the OBGYN, the only nutrient they cared about at all was that I was getting enough folic acid. They said folic acid, but I was getting, of course, the methylated form, but they didn't mention that, which I thought was interesting, because in order to have a healthy child, you need so much more than folic acid or vitamin B9 or folate or 5-MTHF. It's an essential ingredient, but it's not the whole story. So just something to think about. Now, if we go to the next slide, then there is some research linking autism and MTHFR. So there is a 2.79-fold increased risk for developing autism in children with MTHFR, having specifically the C677T type. So if we then look at somebody that has inherited not just the C677T from both parents, but the A129AC from both parents. So this means that they inherited 4 bad risk alleles from all the parents, from both of their parents, 4 bad risk alleles. There's an 8.11-fold increased risk. Now, this is a very rare genetic type. I've actually never seen this genetic type, because most of these, we might see this more in the future because so many people are supplementing with methylfolate now, but most of these pregnancies that in utero have that genetic type, there's such a methylation deficit that they usually end in a miscarriage. So MTHFR, very important. Is there a link with autism? Yes. In another study, they found that women who took at least 400 micrograms, which is the recommended daily allowance for pregnant women, they took at least 400 micrograms of vitamin B9 every day, starting at least 4 weeks before pregnancy and through 8 weeks after. So I would hope that people wouldn't stop taking methylated folate at 8 weeks pregnant. After the start of their pregnancy, but they were just looking at that window of time, 8 weeks before, or 4 weeks before and 8 weeks after. But I would hope that we would have one take the methylated folate for the whole pregnancy. That would be ideal. But there was actually, in these women who were taking adequate levels of vitamin B9 4 weeks before and 8 weeks after, there was a 40% less likely to have a child diagnosed with autism spectrum disorder. So that's pretty significant, and it's even more significant if you go to the next slide and you see that according to a study done between 2003 and 2006, nearly 90% of Americans consume less than the estimated average requirement for folate in their diet. So I assume that those numbers are still about the same. So this is really important. Why is this so important? Because between the 17th and the 30th day after conception, or 4 to 6 weeks after the first day of a woman's menstrual cycle, the neural tube forms and it closes. And once it's closed, if there's a hole left, a neural tube defect, then that's permanent. That neurological damage is permanent. And so the neural tube, it later becomes the baby's spinal cord, spine, brain, and skull. And this means that many women do not even know that they're pregnant before the neural tube closes. So this is important, and women need to be taking folate. Any childbearing woman needs to be taking folate, methylfolate ideally. So if we go to the next slide, these are just some pictures of neural tube defects. They can vary. The most common is spina bifida, but you can see the picture of the neural tube closing, and in the 28-day spinal bifida defect, it didn't close, and that will be a permanent hole there. So could have been avoided with folate, vitamin B9, but Unfortunately, in many cases, it's not. So if we go to the next slide, this is just telling us that people with MTHFR and that are low in methylated folate and B12 are more likely to have congenital heart defects. And so a pregnant woman getting plenty of methylation support, it's not just good for their neural tube in their brain, but it's also good for their heart and prevents congenital heart defects. And if we go to the next slide, then we're going to be talking about another methylation gene, MTHFD1. And this gene is associated with an increased risk of birth defects, such as neural tube defects as well. And this gene, its function, it is more associated with being able to make choline. So MTHFR was associated with being able to make methylated folate, MTHFD1 associated with making choline. So choline, it is extremely important for a healthy brain, liver, nervous system, healthy methylation cycle period, and the MTHFD1 is necessary for the ability to make choline. So anybody that has one or more risk alleles of this need to ensure that they're getting plenty of choline in their diet, such as through eggs and chicken, and even sunflower seeds can help in that regard. But make sure you're getting plenty of these things so that your child can have a healthy brain. Not just your child, but you. So if you go to the next slide, then we look at what this was looking at. This was looking at the cognitive development of children that were born to mothers who were either low in choline and betaine, which are important for methylation, or that had adequate levels of choline and betaine to help with methylation. And what they found is that having adequate methylation pathways, having plenty of betaine and choline in the early days of pregnancy, there is a sensitive window of time where there's neurological development happening in utero that will later translate into giving birth to a child that has basically developmental delays if they don't have enough choline early in utero. So what they found is that having adequate choline and betaine at 16 weeks of gestation is associated with an improvement in an 18-month-old child's gross motor test scores. So I'm sure if one was to do a very thorough study, you could find issues related to not having enough choline throughout all of pregnancy and even postpartum. But for the sake of this study, they were looking at a specific time early in the development. And again, a lot of women don't get enough choline. A lot of women also simply don't know that they're pregnant until they're, 2 months pregnant, or sometimes even further. So in this study, they looked at the brains of mice, and they found that sensitive window of time, if the mice mothers did not get enough choline, then there would be changes to the morphological changes to the brains of the mice. So it's not just a developmental change, there's actually a morphological change to the brain of mice is what they found. So that leads us into now the next slide, getting to talk about what does systemic formulas, what do they offer that is powerful for methylation? And they have some really cool tools in their toolbox that are powerful and unique. And so the first one I'm going to talk about is homocysteine TLR. So this supports the genetic variants that cause high homocysteine and high homocysteine lactone. And if you want to learn more about that, please go and listen to the seminar on homocysteine and homocysteine thiolactone. This is the only product that is directly associated with geared with lowering homocysteine thiolactone, not just homocysteine. So we're not going to talk about that today. But this does support methylation, and it supports methylation in many different ways. So it does have the betaine, and it has the choline, and it has the methyl-activated form of vitamin B9, the 5-MTHF. It also has a lot of vitamin B2 because the MTHFR enzyme doesn't function without vitamin B2. So anybody, including somebody with no problem with an MTHFR genetic variant, but anybody that's low in vitamin B2 is going to be having problems with their MTHFR enzyme not working, which can mirror the same symptoms as somebody with an MTHFR genetic variant. So that's why there's so much vitamin B2 in it. We're trying to get the MTHFR enzyme to work better and not just give you what it makes. We will give you some of what it makes, but we also want to make sure that your pathways are working as good as possible. So it's got also B6, which is essential for, I mean, all of these vitamins are essential for pregnancy, but B6 particularly is very important for pregnancy. A lot of times you'll see females that start to get edema in their hands and carpal tunnel and stuff if they're low in B6. And then it's got the methylated folate, hydroxycobalamin, adenosylcobalamin. So all three types of B12, which not a lot of supplements out there have, if any. I don't think any, it has this exact formulation. And then it's got all the B vitamins. So it's really a powerful methylation tool. It's for two capsules, you get more than the recommended dose of vitamin B9 for a pregnant woman. And you get plenty of other wonderful synergistic vitamins that can really help to promote your methylation pathways. So if we go to the next slide, then we're going to look at MORS. And MORS is another powerful tool for promoting methylation. And it also has plenty of the 5-MTHF, but it also has some SAMe and some other wonderful methylation synergists. So MORS, if you just need a little bit of additional methylation support, MORS is a great tool for that. And ultimately, everybody's a little bit different as far as their genes, and that's why systemic offers different options, because one person might do better on homocysteine TLR, and the other person might do better on MORS, and then somebody else might do really well on EPIC, which is in the next slide. And EPIC, it really helps to promote multiple detox pathways, not just the methylation, but also some of the like superoxide dismutase detox pathways. But it also has a lot of methylation support as well. So these are some great tools to look at whenever you're dealing with somebody with a methylation problem. So we're going to now go to the next slide, and we're going to look at the PEMT genetic variant. So this is the PEMT gene. And this gene, it is essential for the synthesis of phosphatidylcholine, which is really necessary for a healthy brain, healthy liver, good memory, low triglyceride levels, adrenal health. And it's essential because having adequate levels of both choline and phosphatidylcholine is really important for a pregnant woman, but also a lactating woman, and is essential for fetal brain development. So I know that when I was pregnant, I had a really bad bout of pregnancy brain, and I didn't know at that point in time that I had two risk alleles for the top PEMT genetic variant, the PEMT G634A, which is one of the more significant PIP genetic variants regarding methylation and specifically lower phosphatidylcholine levels. But oh my gosh, I had the worst pregnancy brain while I was pregnant, and it even lasted for a while afterwards. And subsequently, I learned I had that, and subsequently, I've seen anecdotally some patients that have experienced pregnancy brain and had some relief from phosphatidylcholine, especially those that had this same genetic type. So that's just something to consider in terms of supporting one's brain while they're pregnant. And, you know, ultimately, women develop pregnancy brain because they get low in phosphatidylcholine. The body tries to increase phosphatidylcholine as much as it can. So during pregnancy, high estrogen levels leads to a higher amount of the PEMT pathway creating phosphatidylcholine. So, but if you have this genetic variant where you just are hindered in your overall ability to create phosphatidylcholine because that enzyme just doesn't make it as fast as other people's enzymes, then even under the best circumstances, you might still be low. And ultimately, you know, the body's really wise in that it will put its resources towards the developing fetus first. And everything goes to the baby, and then what's left over stays with the mom. And hopefully my child had plenty of phosphatidylcholine in utero. I'd like to think so. I know that I don't think my brain had enough, but definitely it's something to look at for women to help keep their brain healthy. Now, if we go to the next slide, and then we can see kind of the flow chart for how this works. So you have this PEMT genetic variant defect, and it leads to a low level of phosphatidylcholine. And then that can lead to health risks and increased risk of health risks such as hindered brain development, memory loss, muscle fragility, fatty liver. If you see somebody that has fatty liver, like high triglycerides on blood work, and there's no obvious reason, like they're not diabetic, they're not overly consuming sugar, then look at this genetic type and see, would phosphatidylcholine help to support lower triglyceride levels? I've seen that succeed many times, and it's a really cool tool. So also increased risk for the infertility, endometriosis, and hopefully increasing phosphatidylcholine, if one knows they have this genetic variant, can help to alleviate some of those symptoms. Now, if we go to the next slide, then you'll see that that PEMT pathway, that's just leading to the production of phosphatidylcholine, and the choline and the betaine and the methylation cycle is an important part of all of that. And then that PEMT pathway is an important part of making phosphatidylcholine. So for those of us that do not have the ability to make enough phosphatidylcholine, there are some tools that Systemic has for us. So again, if we go to the next slide, I talked about homocysteine TLR. So I'm not going to talk too much about it, but again, it's got plenty of choline in it. It's got plenty of methylation support. That's important for being able to make phosphatidylcholine. Now, for those of us that cannot make phosphatidylcholine as well as we would like naturally, then we have, in the next slide, we have Vista-1. Vista-1 comes in pill or liquid, and it's got, as you can see, a high amount of phosphatidylcholine, and added bonus also has phosphatidyl, inositol, and serine, which are also very good for one's brain. So this is a powerful tool, and looking at one's genetic report and looking at the PEMT gene might help to clue one in to needing this specific supplement to help support one's health. So if we go to the next slide, then, we're going to talk, well, we talked about 5 important genes here. We talked about the FADS2 gene, the factor V gene, MTHFR gene, MTHFR-D1, and the PEMT gene. But the truth is that this is really just the tip of the iceberg. There's so much more. We could spend a whole weekend talking about pregnancy and genetics and epigenetics, and I hope sometime we do that. But this is a great place to start. And these are genes that you absolutely need to look at. Now, Systemic has a seminar coming up at the end of May, May 2020, that is going to be in Midway, Utah, and that's going to be a seminar on brain health. And this is a really important concept for everybody, but there are going to be some genes that we're going to talk about that one should really know about during pregnancy as well. And then I also have a webinar that is about nutrition and vitamins and minerals coming up, and that is absolutely ties in to a healthy pregnancy. And I hope that you can be there for that. Unfortunately, we don't have enough time to go over all of those things, but as far as genes that affect iron and vitamin A and vitamin C, and the list goes on, those are essential for a healthy pregnancy. And we'll talk more about those at a later date. So I hope that you guys can be at those, and that you can really learn as much as possible. It's really one nugget at a time. And thank you for joining me for this seminar. I hope that you learned some really good information, and I look forward to seeing you in the future. Thank you.